So we have just a few minutes left. So let's just go for take-home notes. So we have some like 10 take-home notes. And Dr. Tang, Dr. Bradley, please just kind of join. And if there is a specific discussion about those notes. So one was, we say that if people are taking any concurrent psychotropic medications, that should not be a contraindication for people to receive treatment with TMS. So that is one point. Do you have?
Yep.
Okay, so then doing TMS within the approved protocols should be safe. I mean, it's technically safe in people with substance use disorder. And then the rate of seizure is very, very low. So we know there are just under 1%, and even rate of seizure in the actual addiction psychiatric clinic, even if you see, the alcohol use disorder cases that they are hospitalized for detox, the rate of seizure in detox units is something like under 1%, something like 1.7%. So it is just very, very kind of rare to have that. And overall, the benefit overweight risk. So that is definitely what we know about the seizure. And even if the seizure happens, all the case series and case reports of seizure, they are self-limiting. So they are limited in just few seconds or minutes. And there is no, it's not epilepsy, it's just a kind of one episode of seizure. And we as psychiatrists are a little bit kind of afraid of seizure, but if you are in neurology clinic, people seize all the time in front of them. So, and even, they have units and they just wait for people to seize. So, and it is hard to make people seize with TMS. Even there are studies that because of this kind of seizure clinic, they want to make people seize. And they have been using TMS with the highest power to just on the motor cortex, which is the most sensitive area, trying to make people seize, and they are not that much successful. So they realize it's not a protocol to be able to make people seize. So TMS is not designed to put enough energy to make people seize. So it is not like ECT that we have that level of energy. So it is not that a kind of a usual thing to have. And we know that the risk of seizure could be higher if people change their medication, but that should not be a barrier for people to receive TMS. And also, it is also important that all the TMS studies, large trials, MDD, TMS, they excluded people with substance use disorder. And I think that is going to be something that we need to consider, that those trials are supposed to include people. And also, as we have been discussing, training addiction psychiatrists is definitely very important. That is another barrier, to just make sure that addiction psychiatrists, they know that they can refer, that's an effective treatment, it actually works, it's evidence-based, insurance companies cover that. So that is something that, ethically, we shouldn't take that kind of option from people who are suffering from depression in your clinic. And then it's always important to have proper communications with patients and giving them education. They know what is happening, like what Dr. Tang mentioned, in terms of having their perspective. And this is something that we do in our system in terms of, we even develop different materials to discuss about brain and recovery. And we have some kind of different cartoons and kind of educational materials that are cartoon-based and discussing about brain, the process of recovery. And some of these materials are available now in some like 20 different languages, so people can use them. So if you are interested, you can just definitely have access to them. And now we are developing new cartoons for TMS and substance use and trying to communicate with people in terms of what are the pieces of information you want to know about TMS and brain, and that is going to be an important part of the discussion. And now we are discussing in terms of how we can develop a guideline together with ASAM, ISAM, AAAP, specifically on this idea. We have every 2 years, we have a specific meeting on neuromodulation for addiction. In 2024, we had that in New York. The next one is going to be July 30th, 2026 in New York City. So if you are interested, you are definitely welcome to join us on that meeting. That QR code basically gives you to that link. And so we are hopefully in that meeting, Kathleen is going to present the results of their trial. Also, we have a specific, what we call Innovation Day in Addiction Therapeutics in a global level. The next one is going to be in Rotterdam, November 30th. And if you are interested to that sort of discussions, we invite people around the world. So we invite Chinese colleagues, we invite people from other countries, and we discuss about those kind of new innovations in addiction therapeutics. And that might be something that we can further discuss about that. So thank you very much for your attention. Dr. Bradley, Dr. Tang, if you have any conclusions.
No, nothing to add.
No, yeah.
Thank you all for coming.
Thank you.
Thank you.